Hi, this is Suzanne Boe. I'm doing the physical assessment for Nursing One Skills. First thing I'm going to do is show you the work that I have completed. As you can see, the pages here, virtual clinic excursions. I did exercise 2, lesson 11 on these pages. Dosage calculations. I did both chapters 3 and 4 here. So you can see there and there, and here and here, and here and here, and there. And I did my focus charting on my patient, which she had edema, and the patient progress notes. She stated she had edema at the end of the day, 1 plus edema to feet and ankles. My other focus was her tiredness. Patient complains of being tired throughout the day. A negative on the neuro check. She was oriented and alert. And here is my homework for chapter 22, assessing health status. And that is all done. Okay. And the next thing I would do is the patient is going to be waiting in the clinic. We're going to do it in a clinic setting, a doctor's office. And I would go ahead and take her chart and take a look at it and orientate myself to her name and that. And I would walk in, and that is where I'm going to begin my assessment on the patient. One of the things I would do is I would measure her height. And I would measure her weight. I would ask her to take off her shoes before I weighed her, and then I would compare the weight and the height measurements with those previously recorded in her chart. I could also do an eye exam using the Snellen chart. The patient would stand 20 feet behind or in front of the chart. It would cover her right eye and would read which line is clearest to her, and then she would cover her left eye and repeat with the same procedure. And I will go ahead and go from there.
Here, Chris.
And I'm going to walk into the room. Good morning, Jane. Nice to meet you.
Good morning.
I'm Dr. Johnson's nurse. I'm
Okay.
Suzanne. Nice to meet you.
Good to meet you.
And after introducing myself, I would make sure that I would perform hand hygiene. I'd wash my hands and say, well, how are you today? How are you doing? And I would also wash off my stethoscope with a alcohol swab, and then I would go back over and I would do the oral assessment with her, the interview. And I would start out with having her verify her name and that.
Jane Doe, date of birth is 1/1/67.
Okay, good. Jane, I see here that you work here at Ultra.
Yes, I am.
And so do you like that?
Yes.
And so what kind of nurse are you?
Interventional radiology supervisor.
Oh, okay. I've been down to radiology many times. You
Yes.
enjoy it down there?
Yes, I do.
Okay, good. Very good. Okay, and Jane, I need to know about what specifically are you being seen for today?
I just feel so tired all the time.
Okay, so you feel tired all the time.
Mm-hmm.
Do you notice, are you getting a good night's sleep?
I think I am, yes.
Okay. Do you feel refreshed in the morning when you
No,
wake up?
never.
Okay, so you are always so tired. And you said this tiredness continues throughout the day?
Yes.
Okay. Are you having any pain with
No.
that?
No.
Are you having any pain anywhere? Any headaches?
No.
Difficulty breathing?
No.
Any palpitations in your heart?
No.
Okay. How about, are there any medications that you're currently taking?
I take a multivitamin every day.
Okay, every day. Are there anything else, like any herbs you're taking, like ginkgo or?
No.
Okay. Are you allergic to anything?
Penicillin.
Okay, you are allergic to penicillin. Okay. What I'm going to do, first of all, is I'm going to go ahead and we're going to take your vitals.
Okay.
And do a little bit of assessment. And then if you have any questions, just go ahead and feel free to ask me. Okay, so the first thing I would do is I would take Jane's blood pressure. I would locate the brachial artery, which is in the arm right here, and down in the antecubital space. That is where I would be taking my pressure from with the stethoscope. I would locate the blood pressure cuff. I would make sure it is the appropriate size for my patient, make sure that it covers at least 80% of her arm. It's better for the pressure cuff to be too big than to be too small. Once I've located the artery, I would go ahead and put on my stethoscope, and I would put the stethoscope right over the antecubital area, and with the other hand, I would go ahead and blow up the cuff 20 millimeters of mercury past her last normal reading. So if it was 120/60, I would squeeze it up to 140. So I'd squeeze, 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 squeeze. I'd be listening, and then I would slowly let the air come out of the cuff. And the first sound I hear would be her systolic pressure. And then I would let this air out slowly out of the pressure cuff, and this last sound I hear would be her diastolic. Okay, and then of course I would let the rest of the air come out, take off my stethoscope.
So how was it?
It was good. It was 120/60.
Oh, good.
Okay,
Good.
and I would tell her what it was, and then I would go ahead and record that right away because I do not want to forget what it was. And then later I would compare that with her previous reading. Okay, and the next thing I would do is I would want to take Jane's pulse, and while I'm taking her pulse, I would want to look for her respirations. You do not want the client or patient to know that you're looking at their respirations because they might breathe faster or slower. So I would just locate her thumb side and put my 2 fingers right here on the radial artery, and I would look at my watch and I would time it for a whole minute while watching her chest and counting the beats. And I would do this for a whole minute, and we'll just say a minute's gone by. And I could say, Jane, your pulse looks good. It's 70.
Okay.
And your respirations were 18.
Okay.
Very good.
I'm feeling a little warm.
Okay, yeah, and you know what we're going to take your temperature next.
Okay.
And there are many ways you can take a temperature. You can take a temporal temperature, which rolls across the forehead. You could take axillary, which is under the arm. You could take an oral temperature using an electronic thermometer or a regular thermometer, or you can take a tympanic, which is located in the ear canal. And usually doctor's offices require that you do a tympanic, so we're going to do a tympanic. And the first thing I would do is I'd look in her ear canal to make sure there's nothing in there like earwax that would give me a false reading. And so what I would do is I would grab the unit, I would put the probe cover on the thermometer, electronic thermometer, and I would pull her ear up and out and back to make sure that it opens up the ear, and I would insert the electronic thermometer in her ear, and then I would wait for beep beep, and then I would say, okay, Jane, your temperature is 97.9.
Oh, okay.
Okay, very good. And if I needed to, I could also do her a pulse ox on her by putting a little pulse oximeter on her finger. If they're wearing nail polish or something, you would have to remove that. You could also press for to see capillary response. You know, you push down on the nail, does the color return in 3 seconds? And if it does, that means that's normal. And then from there, I would go ahead and go into my her neuro check, and I would have her take off her glasses. And I would say, I'm just going to test your eyes here. And I would start by seeing if her pupils are